The microbe that actually causes the clinical illness is introduced with the bite of the Anopheles mosquito. It infects, it's absorbed into the bloodstream. People with malaria suffer acute fever and chills that can make them unable to work, sometimes not be able to get out of bed. It's similar to the flu. And this can last anywhere from a few days to a week or more. And the more severe forms, of course, can actually kill and do. While the news about malaria, the global toll of malaria, is still horrendous, the good news, the half full glass, is that the toll of malaria tends to be decreasing. It's diminishing each year over the course of the last 5 or 7 years, especially since the richer nations have decided to more aggressively fund interventions to reduce malaria in the impoverished regions of Africa, Asia, and to a lesser extent Latin America. Appropriate measures to reduce the mosquito population, to bring better medications, more effective medications, and to fight counterfeit and substandard medications, to get more rapid diagnostic tests for malaria, so every fever isn't thought to be malaria, although many of them are, and to promote the distribution of insecticide-treated bed nets, which are sometimes unaffordable, even though we would consider them cheap. Many people in the regions that are affected by malaria can't afford them.
So let's go back 2 decades when the malaria agenda was put back on the health agenda. Prior to that, malaria was a fact of life. You die from it, you can do nothing because drugs are, the disease is resistance against drugs. You have not much in terms of prevention. It was fate. And then putting that disease, a major disease burden in Africa, back on the health agenda through health ministers, so the ones who decide on how to spend money within their ministry, was a key first step. And this advent came a bit similar at the same time as we learned that insecticide-treated bed nets can prevent approximately 30% of malaria-related fever deaths. We didn't know that before. So we were left with an ineffective drug that was chloroquine at that time, but we did have an alternative, sulfadoxine pyrimethamine, to get going, knowing that we will need to move towards the more modern combination therapies, but they were imminent in the 2000 to become available.
In our country, malaria was less and less of a problem during the 20th century. And the coup de grace, the final eradication occurred in 1951 when the few thousand remaining cases were eliminated, thanks both to the use of DDT and to the better drainage of swamps and insect control in general. There was some concern about DDT's effects on human health and the environment, starting even in the 50s. But Rachel Carson's Silent Spring, published in 1962, created quite an increase in the concern. Of course, her book was not based on any scientific data. It was basically a poetic call for fewer chemicals in the environment, and her a picture of a silent spring in the title of where insects and birds and fish were no longer present to give us pleasure due to the influx of chemicals, and her primary target was DDT.
The letting up the effort, and there are many factors. There may have been a factor of a product that was used having bad press, but there was also, with the disappearance of the disease, disappearance of systems that deliver the interventions. So monies were used for other purposes, surely good purposes, but there was no continuity. What we also, as you mentioned, there was also environmental modifications that were used to fight that disease. In some locations that did work, and let's take the typical case of Sri Lanka. They had no more malaria because of environmental modification and using DDT. Then they let up the effort. Next thing they knew, 100,000 deaths.
The United States has taken the lead in supplying funding to address the problem of malaria worldwide. Along with the Bill and Melinda Gates Foundation and many other private sector sources, Rollback Malaria as well, and the Global Fund, have all been vigorous in trying to reduce the total malaria. And success is, I wouldn't say it's around the corner, it might be on the horizon, but certainly progress is being made.